Continuing our discussion on what could be sold to a Medicare beneficiary for self-pay, direct pay reimbursement from the patient, as opposed to what requires a claim be submitted to Medicare for covered service. Behind me on the screen, you can see the same LCD. And what I'm looking at here is this paragraph, specifically this sentence, but just to read through. So services which do not meet the requirements for covered therapy services in Medicare manual are not payable using codes and descriptions as therapy services. For example, services related to activities for the general good and welfare of patients. Well, this is one of those areas, right? Activities for the general good and welfare of patients, such as general exercise to promote overall fitness and flexibility, and activities to provide diversion and general motivation. I think that's so much of what we do in outpatient orthopedic therapy. So much of what I'm doing is helping patients return to an active lifestyle, helping patients get healthy. Do I really, as a clinician with 21 years of private practice ownership and having the good fortune of learning under amazing therapists, I really believe if I was going to put my effort into one thing, it would be general health and welfare of the individual. It would be in increasing their general motivation. Like, that's where I think the value is. Yes, I can do something to your rotator cuff that makes it feel better, but ultimately, most of my patients that I treat on a day-to-day basis are dealing with lifestyle disease. They're dealing with sedentary lifestyles, obesity, metabolic syndrome. They're dealing with hormonal changes, stress, poor sleep, poor food, poor gut health. Like, these are the contributing factors that are causing the orthopedic symptoms that they're experiencing. So this would be a situation where I really believe leveraging my expertise as a physical therapist, my knowledge in the profession, my experience with real people, to create specific programs targeting Medicare beneficiaries for the general good and welfare of those patients, general exercises to promote fitness and flexibility, like the whole idea behind CrossFit, right? We want to make you harder to kill. If you're harder to kill, if you have improved function, if you can pick something up, get on the floor, you're going to live a more fulfilling life, or at least have the capacity to live a more fulfilling life. None of that is a covered service under Medicare. Yes, you might have some shoulder pain. You might have some neck pain. I have pain every morning that I wake up for various reasons. Pain in and of itself does not make something a covered service, right? So I think this clearly defines what it is that at least I hold passion toward in terms of what I believe I deliver better than anyone else in my area. And then, of course, we go on to services related to recreational activities such as golf, tennis, running, etc. We all know, right? You have that patient. He maybe has Parkinson's. Maybe he's a passionate golfer, loves golf, wants to get back to golf. He falls 2 or 3 times a week. He lives with his wife in a single family home. He drives, but probably shouldn't. Like, if I asked him on the initial eval, I understand your knee hurts, your back hurts. I understand you're unsteady on your feet. What is your goal for therapy? What is he going to tell me? He's going to tell me I want to get back to golf. What is going to happen in most scenarios? Most therapists are going to know Medicare doesn't pay for golf. I don't want this patient to have to pay anything out of pocket, so I'm going to take this person to a Medicare covered goal when that's not really his goal. His goal is golf performance or tennis or walking or running or some recreational activity. He wants to go back to fishing and being able to walk across the bank to the river or the creek or wherever he's going to go, right? He wants his casting arm to be back for fly fishing. Like, that is what he cares about. So how do you, and I don't have the answer. Like, I know I'm not the expert in this, but I'm asking the question because if we don't ask, we don't find the answer. How do we determine what should be covered? Well, the initial evaluation absolutely should be covered. Only a physical therapist, occupational therapist, SLP can do an initial evaluation. Creating a plan of care, establishing goals, assessment, like education, teaching what the individual what to do. All of that is absolutely what requires the skills of a therapist. But once we cross that line into, okay, we're going to make this a golf performance session disguised as neuro-re-ed, that's where I think we start losing things. That's where I think we start trading something of $300 value for $120 value. That is where I think we let our biases and our passions get in the way of our success. And so we want so desperately for people to feel good and love what we do and what we did and who we are, that we're willing to give away the house, when in reality, Medicare is not paying us to do that. You know, so the next time you have that Parkinson's patient that you want to motivate, which Medicare doesn't pay for motivation, right there. Medicare doesn't pay for motivation. You want them to enjoy coming to therapy. You're going to make it a golf performance program disguised as neuro-re-ed. I think you're giving away more than you probably should. You're certainly giving away more than Medicare is paying for. So food for thought. I don't have the answer for you guys. I wish I did. I wish I could point you in the right direction, but the best I can do is say, here's the resource. They clearly say they're not paying for recreational activities such as golf, tennis, running. It's not covered therapy, you know? So I think we have to respect what it is that the payer pays for. I'll catch you guys on the next video.